do you think that baby Botox is worth it? Because baby Botox is essentially just using less, right?
It is, so it'll wear off sooner. So I always tell patients that before I inject them, we're using smaller doses. So therefore, you're going to see that your movement will be back to baseline sooner than even 3 months. But again, if they're using it very early on, prevention is not exactly because they're really, really bothered by some of these lines. They just want to prevent. It's totally fine that they wait 3, 4, even a little bit longer.
I'm Susan Yara, and welcome to my life online. We're going to have a lot of fun and learn a lot together. Botulinum toxin treatments are a multi-billion-dollar industry. Not multi-million, but multi-billion-dollar industry. We commonly know it as Botox, but that's really just a brand name. There are several different neuromodulator brands on the market, and because it's so popular, the questions around it are endless. That's why in today's episode, I brought on Dr. Annie Gonzalez. She's a board-certified dermatologist here in Miami. She's also known as Dr. G, and she is going to answer all our viewer questions around tox treatments. Dr. Gonzalez, who we will be saying, I'll be saying Dr. G because okay. I feel like this is how everyone refers to you, right?
Yes.
I am so excited to have you here because one of the most popular cosmetic treatments and the most talked about and the one that has the most questions is neuromodulators, which everyone really knows as Botox. Can we first go over that Botox isn't the only brand out there?
I think it's so important to explain that because Botox is the biggest brand that everybody knows. And then it's like Kleenex. Everybody, calls tissue Kleenex. But Botox is just one FDA brand that was the first one approved ever. So it has a lot of reputation, but there's many other FDA approved brands in the US.
Yeah.
So Dysport is one of them. Xeomin is another. Daxxify, which is the newest, and Jeuveau, which I would say out of all of them is the one that I use the least in my own practice.
Jeuveau.
Yeah.
Okay.
But I use all the other 4.
Okay. And what is it? If for someone who doesn't know what a neuromodulator is.
So let's try to explain it in simple terms.
I know.
So that you can follow. So basically, nerves communicate to muscles, right? So the nerve is going to do that by releasing a neurotransmitter called acetylcholine. Mm-hmm. So basically Botox, let's use Botox just so everybody can understand, it will come in and block the release of acetylcholine. So therefore, the muscle is not going to get the signal to contract.
Yeah.
And it's going to paralyze. It's going to cause paralysis or it's going to soften that contraction.
Mm-hmm. What people worry about when they hear the word Botox, they hear botulism, right?
Correct.
And then they get scared that it's going to travel, migrate, whatever, and then be toxic for them, right?
So it's all in the dose. So it's like when it comes to poison, that's really what it is. And we're using a toxin. So usually the doses that we use for aesthetic use in our world, it's a dose that's very safe. It also comes obviously, so it comes with the dose, the formulations that are approved in the US. So it's really important to go to a reputable injector that you know exactly where you're being injected and the precision of the injection, but it's purely related to dose and obviously the actual formulation itself.
Right. Meaning that it's formulated so it's not going to be going all over your body.
It's being targeted the muscle that has been injected.
And why would somebody want to do this? I know, but why would somebody want to use Botox?
We want to age gracefully, right? And I think that's a right we all have. You either choose to do it or not. What you do, whether you put makeup, you dye your hair, this is just another option we have to age beautifully. If we think less wrinkles make us age, more beautifully. It helps to soften these dynamic wrinkles of expression. We all make expressions, some of us more than others. We move certain muscles, that makes us unique. But you could soften that. And that's what we could use Botox for. Yeah. So over time, you're going to get less lines, less wrinkles.
And this isn't even a viewer question, but I think this is one that needs to be addressed. Some people are worried that they're going to get a frozen face.
So that's what we could do baby Botox, right? So it all comes down to the dose again. So the frozen face will come with full paralysis. So if we inject a higher dose, we're going to paralyze those muscles and you're going to look frozen because the muscle cannot move. Versus if we use a smaller dose, we're not going to cause full paralysis. You're going to still maintain some movement, but the movement is not going to be so strong so that you look more natural with every expression that you make.
Yeah. And I'll say for the most part, I want like my crow's feet to be pretty frozen, but right now it's wearing off. Right. And so you can see that I've got my expression lines.
Same here. Well, I probably got my Daxxify injected a few days ago, so it hasn't kicked in yet. Certain areas will last longer than others. So I'm just like you. My crow's feet always will wear off really quick, and we often see because the skin is so thin there. Some of us like a more paralyzed look there because we want to prevent lines there even more because the skin is so thin that lines will show even sooner compared to other areas.
Well, this leads us to one of the first questions. Can Botox actually be preventative? And I say this more so because you see like younger people, like 20-year-olds thinking that they need to start doing Botox, maybe baby Botox, so that they prevent the lines in the future. What do you say to that?
So preventative for sure. So I always say there's no better line than the one you could prevent, right? The one that you're never going to get. Yeah. So if we're starting earlier on, it makes a lot of sense. However, you can't take anything to an extreme. I don't expect an 18 or 20-year-old to start doing Botox unless you make a very strong expression with your glabellar lines, your angry 11s. And we could already see that even when that person is at rest, not making the expression, you could start see these subtle lines that even stay. And I always say that will be your actual cue. Maybe it's time for me to start considering toxin, regardless of your age and everybody's genetics, skin thickness. Some lines may show sooner than others. So that's why there's so much variability. And at what age? I don't like to define it so much by a number, but it's totally preventative overall, in the population. The earlier you start, I probably started in my late 20s, 28, 29. So the earlier you start, the less lines of expression you're going to have later on, when you're in your late 40s, 50s, and obviously 60s. So.
But one thing I do like to point out to people is, yes, preventative, but when you're 50, you're not going to suddenly be like, you know what, I don't need to do Botox anymore, right?
Yeah, so I get that all the time. Patients that come in with already all these lines of expression that even without them making that expression, that you could already see the places where they make expressions because you see all these lines that are etched into the skin. So I could already, it's a roadmap. I could see what the expressions are and which ones are the dominant expressions for them. And sometimes they expect to have the same result as maybe that 25-year-old that's doing it for prevention. Why didn't my lines magically disappear when I'm doing Botox? So I that's where education comes in. So for us providers, we have to sit with the patient and explain to them, your result cannot be expected to be the same as for someone that's doing it for pure preventative reasons.
Right.
So I always say, stretch out your skin. If you have a line there, if that line doesn't fully disappear, even when you're stretching out your skin with your fingers, then that means probably Botox is not going to be able to achieve that.
Yeah. Oh, that makes sense, actually. Yeah. So it's having realistic ideas of what any cosmetic treatment can do.
Absolutely.
Right. That makes sense. But back to the preventative, when people think that they're doing it for preventative measures, that doesn't mean that it doesn't mean that they're preventing them from doing Botox later in their life, right? Like that, they're still going to probably have to keep doing it.
Absolutely. So this is something you're going to have to continue to maintain.
Yeah.
So most of these toxins will last 3 to 4 months.
Yeah.
So the muscle is not going to you're not going to need it any less just because you started earlier.
Yeah.
And actually you're going to get used to that look. Yeah. So that's what I tell every patient, including myself. If I do Botox 2 weeks later, I'm going to look great. I'm going to get used to that look. I'm going to look refreshed.
Yeah.
And 3 months later, you betcha, I'm going to want to look exactly the same.
Yeah.
And I'm going to keep on going for that treatment. So it's like if you do your hair, you dye your hair, you're going to see your roots grow. You may want to go back to that, right? So it does require maintenance. Exercise is no exception.
Yeah.
You get toned, you got to continue working out to maintain those results.
It's probably something to consider if you're like 20 and you're like, I'm going to start doing preventative Botox. That means you're doing Botox since you're 20.
That's a very good point.
Yeah.
Yes, for sure. So you're going to have to continue doing it.
Well, that leads to another viewer question, and one that I've actually talked about too, and that is resistance to the neuromodulators. And when does that start happening? Is it a chance that you're taking if you're starting younger? Is there a possibility that you're going to need more and more as you get older, or you might even become resistant to it?
So yeah, this question is very complex, and I think still a lot of answers that we do not have, and we need more studies to look into this immunogenicity and this issue of resistance that has been coming up. We saw a lot of cases or people talking about it more after COVID, but the reality is it can happen with any immune response. And we don't know why you may have that immune response secondary to any virus your body is exposed to. But it could happen with a vaccine. You could get a vaccine and you could have a very strong immune response to that. And then those antibodies can sort of recognize mimicry. And if you're exposed to the toxin around that time when there was a peak immune response, the theory is that then now the molecular mimicry is going to make that antibody go after that toxin and neutralize it. So you won't have an effect.
Wow.
So timing is also crucial here.
Yeah.
When is that immune response peaking creating all those antibodies, because maybe the timing was perfectly right. So maybe it wasn't peaking. And that's why, even though you were exposed to COVID and so was I didn't get that response. So it's a very individual response. Everybody has a different immune response, even though we could all be exposed to the same agent or pathogen. But it could also be the timing at which the toxin was exposed.
Yeah.
After you were exposed or you were having that immune response from other entity.
So then could you maybe just take a break from using that brand of toxin and then try it again later?
And that's what we try as providers to tell patients, let's go ahead and go with longer breaks, which also takes me to another answer to your question. When patients try to do their toxin way too close of an interval, so not respecting that 90-day window minimum, that could also put you at higher risk.
Really?
Correct. Yeah. So
this is like taking your antibiotics. Like when your doctor's like, you're like, I'm sick, give me my antibiotics. And they're like, nope, you were already on a round, or you need to finish off this round.
Exactly. So if you're going too close of an interval, instead of at least waiting the 3 to 4 months, that could also put you at risk for that kind of resistance. Also doing very high doses. So that was looked into as well. Just like a low dose may make it wear off quicker.
Yep.
Doing a very high dose because you want to be totally paralyzed could also put you at risk for a higher immune response. So there has to be more studies that really study all these variables.
Yeah.
Very hard to isolate them because, we're humans and we're exposed to so many things at once. So that's why the studies are very complicated.
Yeah.
And to do proper randomized controlled trials and look at all of this. But I think with more cases coming up of resistance, more studies should definitely be coming up.
So you're starting to see more resistance amongst your patients?
Absolutely, yes. And patients that stop responding. So a lot of the currently FDA-approved toxins are all the same type toxin A. So
meaning that they're targeting like a specific protein? Is this what I heard?
So these are all produced. This is a purified protein type A.
Okay.
And all the ones that we use for in the aesthetics world, all the brands have the same active ingredient. Their differences come in with the accessory proteins, the carrier proteins, and other things that just subtleties here and there. But the active ingredient is the same.
In all the brands?
In all the brands.
The ones that you mentioned? Okay.
Correct.
That's good to know.
Even though their formulas are slightly different. I'm not saying that they are. But now what they've seen in some patients that are resistant to all of those in the aesthetic world, sometimes they've tried the other purified, the type B.
Okay.
Which is a different type of tox.
And what would that
some
brand
patients can respond.
So you're saying there is a type B. Is this something I should be looking at? What is it?
Yeah. So what some of my patients tried when they stopped responding to all the brands that are approved here for aesthetic use, some of these people tried the type B, which is only used for medical use.
Oh, okay.
MyoBlock. Because that's a brand.
MyoBlock, okay.
So then they saw a response with that. However, I'll tell you, a patient of mine actually tried MyoBlock. I didn't do her MyoBlock, but she had another provider do MyoBlock before she came to me. She had a good response at 2 weeks. A month later, none. Gone, even MyoBlock.
Wow.
So there's cases that we still can't explain to just stop responding completely.
Are you seeing like an age range or like anything, or there's just so many different factors and you can't even like narrow it down?
I can't even narrow it down because I have seen it in 60-year-olds and I have seen it a lot in that 30 to 40 something year olds.
Yeah.
Which I would tell you most of my patients have been in that late 30s, 30s to 40s. Yes.
Yeah. This is scary because we're so dependent on our tox treatments.
I know. I am. The moment it starts wearing off,
you're like, gotta get back in there.
Yes.
Yeah, for sure.
So that should be hopefully an area where we look more into.
Interesting. Well, it has happened to me. I went from Botox I did Botox since I was 30, found that I was resistant to it, where it was like working for a second and then I would immediately just go away. So then I moved on to Xeomin. And now I feel like the Xeomin stopped working on me. So I'm kind of like, oh my goodness, what is going to happen here now?
Oh my God.
Yeah.
So do you see it immediately after, even 2 weeks later, you didn't have the same response to Xeomin that you used to?
Mm-hmm.
Wow. Mm-hmm.
So now I'm getting a little concerned.
And
this is my favorite treatment.
Because sometimes what we do is alternate and try a different toxin. So have you tried all the other ones yet?
I think I'm going to go ahead and go try Daxxify next or Jeuveau or one of them. But that's why when you said that they're all targeting the same protein or the same type A, I'm kind of like,
Yeah, but then the other thing that they have looked into is that sometimes the immune response is not exactly against the active ingredient or the type of toxin, but the carrier proteins.
Interesting.
Or these accessory proteins, because it's all a molecule, right? Mm-hmm. So, I mean, Xeomin is known for being the naked one because it doesn't have a lot of these accessory proteins, but all of them contain actually albumin, and it's human or animal derived. Most of them are human derived.
Interesting.
Except Daxxify, which is peptide power, more like made in a lab. Then they think that it's not always the antibodies against the active ingredient itself. So that's why some patients may not respond to one, but they do respond to another. So you still have hope.
I still have hope. Thank goodness. Well, I mean, maybe since I've been doing Botox since I was 30, I don't need to worry too much because I prevented it.
Well, actually, it's really interesting. They had a study of two identical twins, and then one did Botox every 6 months.
Okay.
Right. The other one only did it twice in a span of, I think it was 10 to 12 years. I can't recall now exactly how many years in the study. I mean, the way the one that used to do it every 6 months age was significant. She looked so much better than her twin sister, her identical twins, and they have the same genetic makeup. So
I have seen these pictures and it is
pretty impressive.
It's mind blowing. Yeah. You definitely are like, yeah, you know what?
Just for the shot.
Yeah, exactly. Okay, so one of the questions that we saw was, if it's a bigger area, do you need more? Which I think is a pretty obvious answer, but I think that's a good question.
You know, some toxins will spread more than others. And usually it's not so much if it's a bigger area, do you need more? And I would tell you that for sure is not true, because sometimes we could use the same dose in the eyes than in the smaller area on the forehead. But it's more how strong is your muscle? So some patients have a very strong frontalis. So they make tons of lines there, and you could tell, or men, for example, they have very strong muscles there. So I need to use a much higher dose on their forehead versus a female that maybe has the same size forehead, but her muscle is not as strong.
That makes sense.
So it's more the strength of the muscle that will determine the dose, and obviously the desired effect. If we want a softer versus a more frozen look, that will determine the dose that I'm going to use for that patient.
Are there different ways that neuromodulators are used besides just for aesthetic reasons?
Absolutely. So so the first, a lot of them actually debuted is in the medical world. So we use it a lot for dystonias, muscle spasms, overactive bladder.
Oh, overactive bladder.
Yeah. I wouldn't be able to tell you so much about that, but for sure it's been used for that. So,
and for sweating.
It's very so for hyperhidrosis, we've used also that in my field in dermatology. We use it a lot for underarm sweating. It works wonderful and patients tolerate it very well. I would tell you for palm and soles, it could be used, but it's very painful to inject, as you can imagine, all the nerve endings there. But it could temporarily help with less sweat there. So patients see 4 to 6 months out of that.
The one I hear the most and probably has surprised me the most is women who get migraines a lot. And then even when they're pregnant now, they're starting to get their neuromodulators. Yeah,
so the neurologists use a lot of that for migraines, and they use much higher doses. Also, they inject it in a whole different pattern. But yeah, I think that's very promising for sure. And a lot of patients get relief from that. And I think for patients, a lot of the migraines even originate from a lot of tension, and that ties into trap talks, Barbie talks that became so popular.
I tried it.
Tell me.
I liked it because I was getting a lot of migraines. And I'll tell you, actually, when it wore off, because they did Daxxify, so it stayed a little longer.
Okay.
Not for a whole 6 months, but it stayed like 4 months or something. There were pros and cons. The pros were my migraines really did kind of stop. I was being a little less tense in that area. Ever since then, my migraines haven't been as bad even after it wore off. It's been over a year now. So that's been amazing. But when I had it, there's always that like side effect of what kicks in, like what other muscles kick in. And so when I would look at myself in pictures after it kicked in, I look like a bodybuilder because I would be straightening my neck when I was smiling. So like this would lay nice and flat, but then my neck would be, because we hadn't done my platysmal bands. So these were just like popping and this was like completely flat.
Wow,
and I thought that was hilarious because it was like, you've got one thing smooth, but now the other thing is kicking in.
And that brings out an important, and I have some good stories about things that have happened to me as well. When you inject one area and you don't inject the other. When patients say, well, if they're on a budget, I'm trying to just inject one area, don't do the other. Especially it happens a lot with angry 11s, the glabellar lines and the forehead lines. well, that's when you really start compensating with other muscle groups that are nearby. And you can see it even more. It's like if you're cleaning a room and you're leaving one mess in one little corner, you just make it so much more obvious. And compensation for sure, muscle compensation does happen.
Have you heard about neuromodulators like Botox being used for hyperpigmentation? Because I've started hearing this lately where they're doing like hyperdilute
mesotherapy type of thing.
Is that what it is? Where they're like almost injecting it? Because they've seen, right? Neuromodulators already just make your skin texture look better, right? Because it kind of smooths out.
I actually use it a lot for skin texture. Your pores look so, that's why I think we started noticing it a lot when we're injecting foreheads. That's a larger area. So you're able to appreciate that texture improvement. And 2-3 weeks later, you'll see these patients with a glow. Your skin just looks smoother. It just looks so glowy, so radiant. So then we started using it in the context of more superficial, hyperdiluted forms to improve the look of the skin, that porcelain pores. The pores look a lot more refined. The texture looks refined. So there's that benefit definitely when you inject it more superficially. So you're not going to be targeting the muscle in this case.
Okay. So it's really just like at the top layers of your skin.
And what I've seen, even patients that suffer from redness, erythema, the rosacea patients with a lot of little blood vessels, we've seen that even there's been case studies where they've published that you see even it does improve that as well, that facial erythema.
Ooh,
so very beneficial for these patients.
Yeah, but for the hyperpigmentation I'm assuming, since it hasn't been brought up to me because I'm like a melasma girl, I'm always trying to find the next treatment for melasma. It hasn't really been brought up to me as an option. So I'm going to assume that this is still kind of experimental.
Very much so. Yeah, I would say anything that could potentially improve skin barrier, but I don't see how even toxin could be. Mm-hmm. So yeah, I'm kind of very experimental, I would say.
Yeah.
We need more research on that.
Definitely. Okay. That's good to know. So don't go popping into any derm's office and be like,
but mesotherapy will have so many other benefits that I think you'll probably love it either way.
Yeah.
But
sounds good.
I think it's way too promising to tell you that it can improve melasma or pigmentation.
Got it. One of the biggest issues that we see with neuromodulators, especially when you go to somebody who maybe is more inexperienced, where people are like popping into med spas where it's just kind of like
especially in Miami.
Yeah. Seriously. You see people get like ptosis where it drops their eye, or maybe their mouth looks a little bit, off because, they didn't hit the right muscle or something. What can people do? Well, first off, why is this happening? And should people be concerned about that? But second, the question is, what can people do if that does happen? If they do get like a dropped eye?
Okay. So what does it happen? A lot of it has to do definitely with technique. So where you're injecting it, these are very precision injections. We're targeting muscle in very specific groups. So that's why your injector needs to know exactly what they're doing when they're injecting, what their purpose is. Mm-hmm. And that's what we tell patients even after the treatment. Don't go rub that area because you don't want that diffusion to go into it. Nearby muscles that were not the targeted muscle.
For up to how many days after you get the treatment done?
So I tell them for at least 2 days and, avoid rubbing or anything.
Don't
or
get
getting
a
facial massage, pressure in that area. So that's something to keep in mind.
Okay.
Same thing goes with even exercise. I tell them to avoid it because when we're exercising, we're also engaging all these muscles, but also the blood flow right after the treatment as well can potentially increase our metabolism. So going back into things that can make it last longer or less. That could be one of them.
Oh, so then let's say it does happen though. Because I've even had the most experienced, amazing board certified plastic surgeon drop my eye years ago. This was years and years ago. I think like techniques were still being, I've been around for a while. So, like we were still testing out techniques and stuff, but I did get a dropped eye one time. And back then he gave me some eye drops, I remember, to try to make it go away. But is there anything nowadays? This was like over a decade ago.
Unfortunately, there's nothing to reverse the effect of the toxin yet. And maybe this is in the near future. I really hope so, especially with longer lasting formulations that we're having, like Daxxify, that could last a little bit longer. I hope that, just like we have something to reverse filler, one day we have something to reverse toxin. It should these things happen, because if not, you just have to let it wear off on its own. And then what I usually tell the patient is, anything that would increase your metabolism, exercise more, move the muscle more, that would just make it wear off quicker. Yeah, for the eye drops is more to help with compensation of another little muscle that we have here. When you put the eye drops, you activate that muscle, so at least your eyelid looks a little more open. However, if you have a drop eyebrow, forget it, because that's actually different. So you'll have to live with that eyebrow
for at least 3 months.
For at least 3 months. Yeah.
It happens. It does happen. So it's more reason to go see somebody who is a professional, but it can happen. no matter who you see, right?
Absolutely.
Yeah. You talked about making it last longer or make it like, that's definitely one of the questions. I think that, you've seen these videos where people talk about taking zinc and stuff like that. Are there things you can do to make your toxin treatments?
I saw that everybody was publishing on social media, hey, take zinc, the 50 milligrams, and it's going to help you extend, and everybody's dealing with Botox not lasting very long. So obviously here, everybody's going to check see if zinc is in the cabinet and start pulling the 50 milligrams. However, that study refers to something from 2012, super old study, very limited sample size. Other people went in and tried to look into the study and they found many flaws. So there's still so much more research that needs to be done. And very few people are actually zinc deficient that could probably benefit from this. And how exactly, so you have an idea where that this has a bearing on Botox, is because the enzyme that cleaves the SNAP25, the whole acetylcholine release, is very complicated chemistry there. But basically, zinc aids in that process of cleaving it.
Okay.
So that's why they think if you might be low in zinc or have a true deficiency, then that's why it could be a problem.
But you would have to actually be low in zinc then.
Yes. So the 2012 study, there were many flaws. I think more studies need to be done to really validate and give this recommendation of just simply taking zinc 50 milligrams for 5 days is gonna.
Otherwise, it's just your metabolism is a big factor.
If you exercise more, it will wear off quicker. You're engaging these muscles more. Individual metabolism for sure. Some people metabolize some quicker than others. I would say those things will be, the more you use a muscle group, the quicker it's going to wear off there.
Right.
Do you get really weak when you did your trap talks?
I didn't actually, no.
No, it didn't affect your weightlifting?
No, it did. I could tell. But no, my personal trainer was worried about that.
Yeah, no. I was a little. What about, did it get smaller? Was it visibly smaller?
Yeah, actually, it did get smaller. When I did my. Are you like, should I be making this a suggestion more often?
No, I do it for patients, but honestly, I love to weight train. So then I was afraid it could compromise my ability to do heavier lifts.
No,
especially overhead.
Yeah, a little bit. You notice.
Okay,
but then you compensate. So it's like, for me, it turned into my neck overcompensating, but so you'll probably see something.
Because we usually allow for facial slimming. So that's why I thought if you notice atrophy, even with the first injection. Yeah. So you notice that they look smaller even after just one round.
Yeah, but it took a little while to notice it. But yeah. But it was Daxxify. So I had like a few months where I was like, girl, I need to do my platysmal bands because man, I was looking like the Hulk.
Yeah. So when we use it for facial slimming for patients that are very broad here, especially in Asian patients, it's very common, or they do a lot of clenching. So you have to assess a patient to make sure that they're not just broader for, it could be even their glands, their parotid glands. So I see a lot of patients that get treated for masseters, but it's really their parotids that are giving them width. So you really have to assess to see when they clench down, if it's true muscle hypertrophy. Yeah. And if that's what's contributing to the width of their lower face, then you inject them and you could see that it actually slims their face.
Yeah. When masseter or Botox was starting to become really popular and you'd see all these like celebrities with these like tight jaw lines that were like really angular, I immediately, because I'm half Asian, so I was like, oh, I'm going to go do this for my masseters. And then the doctor touched my sides right here and he goes, your masseters are like non-existent.
Yeah.
They're not even there. It's just your face. I was like, that's a bummer.
No, and I'll tell you something, as we're in our 40s and if we start noticing slight jowling, which is normal to notice around this age, I don't inject my masseters, even though I do clench at night and I do wake up with some tension. I rather wear my night guard, take my magnesium and go from there. Yep. The reason is even a little bit of bulking, which you don't want to, I bite down, you can see I do have a little bit of a hypertrophy there. It doesn't bother me because I don't look broad, number one. Number two, I don't want any jowling now that I don't have a muscle pulling that skin back. I leave them as I don't inject them.
I tell people this all the time when buccal fat removal started becoming so popular. Yes. I'm like, you're going to miss that fat someday.
Absolutely.
So it's the same with the masseter Botox.
Yeah, it is giving you some volume and holding the skin back there. So if it's not a huge problem, don't do it.
Yeah, I love that. That's really good advice. That's an interesting one. So the masseter Botox is an interesting way to do it. Somebody also asked about nose tip Botox.
Yes. So that's a little muscle that we have under there, right at the base of the nose.
Kind of going here. I was thinking literally the tip.
No, it's a depressor septi nasi, which is a little muscle right here at the base. It attaches to the cartilage there. And it actually also has an attachment to the orbicularis oris, which is a muscle that moves around the mouth. So what happens is when these people are talking or smiling, you see their nasal tip move down because it does have a connection to the mouth. So if you're still, you might not even see a nasal droop.
Yeah.
But it's only when they're animating. So that's why it's really important when you assess a patient. If I see that their nose tip moves when they're talking or smiling, I'm like, okay. Then it's worth injecting just a couple of units. It doesn't take much more than that.
Yeah.
And then they'll stop with the nasal drooping.
I guess it's not something that's ever bothered me. I don't think about that. But
Me neither.
That's interesting.
Yeah, but some patients do bring it up, and then I assess them. And because some of them, due to genetics, their cartilage, also in all the connective tissue, getting weaker, they could have a nasal droop, but it's not because of the muscle overactivity. So that's completely different because those who need a tip rhinoplasty and stuff like that, that's something that if I inject Botox, I'm not going to just elevate their tip if it's not something that I see worsens with animation.
Since we're talking about the nose tip Botox, what are other really interesting ways? We said the masseter, the nose tip. What are other interesting ways? Right, that's true. Lip flip has gotten really popular as an interesting way to use it.
Yeah, so a lot of the patients that are a little scared to do lip filler, they ask me, what if I do a little lip flip? So again, assessment is key in education before you do any procedure. So I say, well, do you like your lips when you're still? Do you like the volume, definition, the borders? If they're happy with that, it just happens when they animate. Again, animation here is key. And the lip rolls inward. It kind of disappears when they're smiling.
Yeah.
Now that patient is going to be a good lip flip patient. They're going to be happy with the results.
But it's only going to last for about 3 months.
Yeah. And even quicker because you move, you're masticating, you're chewing. So all that movement that we do with our mouth all day long, and they say women, we do it a lot more than men do. Yeah. So what happens is it's going to wear off even sooner. You're going to see that it might not even last those 3 months. We're also using very little units because we don't want to create incompetence. There's nothing worse. I don't know if you've seen, there's certain movies, now I can't recall which movie, that you can't even drink from, you can't either, sip from a cup or, drink from a spoon or straw. You can't suck from a straw. You could make them incompetent really easily. So you have to use very low doses. So it has to be very properly placed. Technique is also crucial here. So they have a beautiful result, but they don't look incompetent. Sometimes even pronouncing certain words becomes very difficult.
Ooh, yeah.
As you can't move that musculature, which is that muscle that goes around the mouth, the orbicularis oris. So then it'll wear off sooner because you're using such a small dose. Yeah, and also a very dynamic area. So yeah.
Well, so then do you think that baby Botox is worth it? Because baby Botox is essentially just using less, right?
It is. So it'll wear off sooner. So I always tell patients that before I inject them, we're using smaller doses. So therefore, you're going to see that your movement will be back to baseline sooner than even 3 months. But again, if they're using it very early on, prevention is not exactly because they're really, really bothered by some of these lines. They just want to prevent. It's totally fine that they wait 3, 4, even a little bit longer.
When you're aging, do you need more Botox? Like when you start off, obviously with baby Botox in your 20s, when you're like 60, do you need a lot more, or is it maybe just a little up?
I'll tell you what I think about that, because patients do bring that up all the time. I think based on purely on observation, right? As we age, we're going to see there's going to be a lot more degradation of that skin, of that dermis, more wrinkles are going to loss of elasticity. So they think that the Botox that you used to have, the same dose, it's not going to have the same effect because there's other factors that are happening with aging. There's also less fat there. The fat pads are shrinking. What happens is that you have skin, you have fat, and you have muscle. So as your fat pads and that amount of fat in there is diminishing normally as we age, it's like a mattress. You're going to see more of that dynamic discord that we call, with just basically the skin getting thinner also as we age on top of muscle contraction. You see every single muscle contraction. There's no longer this fat in between to help modulate that. So now you think, why do I have the same dose, but the effect is no longer the same? It's just other things that are happening with the aging process. So that's why it seems like it's not, but it's not that your muscle is necessarily getting stronger, even though in some areas we could hold a little more tension. Like usually I see it a lot. I use a lot of dimpling, the dimple chin. We use a lot of Botox in lower face. That's off-label areas, by the way. But some patients notice that this area, for example, they could some of that area can become a little stronger over time, but typically it's the same dose.
Not necessarily, but we are aging and we should always just keep that in mind.
There's many other things changing. So yeah, you're probably going to need other things besides just Botox as we get older. I think Botox should be complemented by other things like energy-based devices, lasers, radio frequency, ultrasound-based therapies,
Maybe
anything for skin tightening. And obviously if you need volumization, you need some fillers, biostimulators. So it should not just be that Botox can do it all because it's just one aspect of aging, but there's many other things happening simultaneously.
And then the last question, which is the most controversial, but I think all of us who have been through pregnancy and breastfeeding and everything, we want to know, can we do Botox?
Yeah, I was dying to do it. When can I do it?
Yeah, I know. But can we do Botox while we're pregnant? Can we do it while we're breastfeeding? What are your thoughts?
So definitely a big no-no for pregnancy. No safety data. I would always say this is an elective procedure, so do it after. With regards to breastfeeding, I know more providers can become more comfortable to doing it around that time. Same thing with tretinoin use, for example, around that time. For me, it's still, I personally tell my patients, we're going to hold off until you're done breastfeeding before we do at least injectables.
Yeah, that makes sense.
We could get started with the lasers, the RF and everything else and the skincare, but for injectables, any substances that are being injected, I'd rather hold off until they're done breastfeeding.
Yeah, that makes sense. And it's mostly, like you said, it's because you feel like there's just not enough information.
Yeah, it's, who will volunteer and say, well, let me see what happened. Let me be the person, so that's why usually a lot of these studies are lacking.
I had a friend say that even if it doesn't do anything, she's a dermatologist also, she just doesn't want to take on that responsibility because we've all known this as moms, right? You associate any issue that comes up with your kid with something that you did. You're like, oh my God, I shouldn't have eaten that bologna while I was pregnant, or I shouldn't have gotten that Botox while I was breastfeeding. Maybe that's why something happened. So
yeah, and then you think for vanity, right? Just when that could wait 6 months, even if it's a year that you were breastfeeding for.
Yeah.
It's probably fine.
Well, this was so enlightening. I had no idea we could spend this whole time talking about neuromodulators and Botox. So thank you so much.
My pleasure. Thank you so much for having me.
I appreciate it.
I appreciate it.
Thanks for joining us on this episode of My Life Online. If you enjoyed this podcast, make sure to follow, rate, and review, and also share it with a friend so we can continue making great episodes for you. You can also find me on social media. I'm at Susan Yara. And if you enjoy beauty, especially skincare, make sure to check out my YouTube channel, Mixed Makeup. I'll talk to you soon.